If you are an ApoE4 carrier like me and you are watching this, the next 30 seconds could fundamentally change how you think about testing for Alzheimer's. So earlier this year, something historic happened. The FDA approved the first blood test for Alzheimer's disease. No more spinal taps, no more $5,000 brain scans, just a simple blood draw that's up to 97% accurate in detecting brain changes 15 to 20 years before symptoms even appear. And the great thing is for us ApoE4 carriers who face up to 33 times higher risks of developing Alzheimer's, these tests work even better than traditional methods. I believe this is the beginning of very accessible, affordable testing that could actually save our cognitive future. Hi, I'm Dr. Kevin Tran, Doctor of Pharmacy and ApoE4 carrier. I'm also the founder of the Phoenix Community, a platform dedicated to helping ApoE4 carriers beat the odds and outsmart Alzheimer's. Through my personal journey with ApoE4, I dive deep into the latest research and I translate complex findings into hopefully clear, actionable insights we can apply today to take control of our brain health. So today's video covers 9 breakthroughs presentations from the world's leading biomarker researchers, and what they've discovered is not incremental progress, it's actually complete transformation in how we detect, monitor, and predict Alzheimer's disease. We're talking about blood tests that outperform invasive spinal tap, smartphone apps that track cognitive changes from your couch, and imaging techniques that see neurodegenerations years before brain shrinkage begins. So for us ApoE4 carriers, we're constantly tweaking with experiments, supplements, and interventions. Having a way to monitor progress is really important. So this is coming at the best time. Let me show you exactly what's now possible. So the conference opened with news that sent ripples through the medical community. Dr. Noel Warmenhoven from the Lund University presented data that fundamentally changes everything we thought we knew about Alzheimer's testing.
The first blood test for Alzheimer's disease received FDA approval earlier this year, and that means that doctors in the US can start using this test to help diagnose their patients.
Here's where it gets fascinating. This isn't just about convenience, it's about superior accuracy. So the blood test measures something called P-tau217, phosphorylated tau at position 217, which is essentially a protein fragment that appears in our blood when brain cells are under attack. Think of it like smoke from a fire when neurons are damaged. P-tau217 levels rises in the bloodstream, typically measuring above 4.4 picogram per milliliter in those with brain pathology compared to under 2.2 picogram per milliliter in healthy individuals. So those researchers compared these new blood tests directly against FDA-approved CSF tests, so those cerebrospinal fluid tests, which require to tap into your cerebrospinal fluid, and that is extremely painful. You have to do that in the hospital, and you have a high risk of infection. So they tested against that, and what they discovered challenges decades of medical dogma.
We first applied a single FDA-approved cutoff in which we used the upper cutoff. And with that, we saw that P-tau217, the ratio P-tau217 to amyloid 42 in red, had an accuracy of 92% in the memory clinic cohort, which was non-inferior to that of CSF.
92% accuracy from a simple blood draw. That's amazing. The researchers didn't actually stop there. They refined their approach using what's called the 2 cutoff method, creating 3 categories. So clearly negative, which is below 95% specificity threshold, clearly positive, which is above 95% sensitivity threshold. So for those who don't know, those 2 are very important because you don't want false negative and you don't want false positive, right? And then you have an intermediate zone requiring follow-up testing. And when they did this,
we applied 2 cutoffs, and then we saw that the accuracy of the plasma ratio increased to 97%, which was actually significantly higher than that of CSF.
All right, let that sink in. The blood test didn't just match the invasive spinal tap, it beat it. For us as ApoE4 carriers, this means we can now track our brain health regularly without the risks, the cost, the discomfort and the high pain of spinal taps. So currently this P-tau217 test will cost around $300 to $400 in the United States compared to the 3 to 5K for a PET scan or 1 to 2K for CSF analysis. It's such a huge progression. If you are wondering, you can actually order these tests with your typical physician. So while blood tests revolutionize accessibility, Dr. Satya Kotapalli from Washington University presented something equally groundbreaking, a way to see neurodegeneration before the brain actually shrinks. Using an advanced MRI technique called QGRE, they are measuring what they call NDI and MDI. This is for neuronal density index and myelin density index. In simple terms, they're counting brain cells per cubic millimeter and measuring the protective fatty coating around the nerve fibers that speeds up signal transmission. And that helps detect damage while there's still tissue to save.
We identified significant group difference in neuronal density index and myelin density index, even when the PIB standard cutoff for separating amyloid positive and amyloid negative participant was reduced. While NDI and MDI were able to differentiate groups, even when the amyloid positive groups included participants only within MCSUVR of 1.6.
To understand this, SUVR is for standardized uptake value ratio of 1.6 that represents very early amyloid accumulation. The traditional cutoff is 1.42. What makes this particularly relevant for us is the timeline. The traditional MRI only shows brain shrinkage after you've lost about 20 to 30% of neurons. That's like seeing the ruins after a fire happens. But this new technique sees the smoke while the fire is just starting, detecting changes when neurons loss is about 5 to 10%. And incredibly, it only takes 6 minutes. This is really, really important for us APOE4 carriers because the earlier you can detect changes, the faster you can actually act on it. And we've seen in other videos of the AAIC that I posted a few weeks ago how important it is to detect early and act early.
Finally, the QGRE requires only 6 minutes MRI scan and provide valuable insights into microstructural neurodegeneration during early stages of the amyloid pathology prior to the detectable atrophy.
Now, detecting brain change we know is crucial when it's early, but we also need a way to monitor our cognitive function regularly because that's how you know if your interventions work or not. So Dr. Rose Jutten from Amsterdam presented something that could transform how we track our brain health, which is basically the mobile toolbox developed by the NIH. This isn't just another brain training app that you can see everywhere. It's a validated cognitive assessment you can take on your phone that measures 4 key domains. 1 is episodic memory, 2 is the attention, 3 is working memory, and 4th, the processing speed.
The mobile toolbox developed by the NIH is a smartphone-based application for self-administration on an individual's own device. It is a multi-domain cognitive test battery that is based on the well-validated NIH toolbox.
So if you're a member of the Phoenix community, you already know how we emphasize early testing to establish those baselines, and then when you run experiments, you want to compare the results against those baselines because all the proxies you can have through measuring blood tests or biomarkers, the real thing you want to optimize for is functional cognition, right? You want your brain to function. It doesn't matter if you have very bad biomarkers. If your brain functions perfectly until the end of your life, you are golden. And this is why having a 360 view on all the different parameters of how your brain functions, from blood biomarkers, of course, but other ways to measure this is extremely important. So what is cool about this app is it's sensitive enough to detect something called the loss of practice effect. And to explain a bit the practice effect, well, the more you do a specific test, the better your result is because you get used to it, and the more you practice it, the stronger your result. That creates a lot of biases in a lot of tests that you can do for cognition. Well, this specific app is actually using that practice effect that is usually a bad thing, right, in all the tests you can do. The other way around, they are looking at if you don't build that practice effect, or if you are losing that practice effect, it means that you have cognitive decline. And this is a very smart way of playing around this practice effect that has plagued a lot of these diagnostic apps. And what they've seen is they managed to detect signs 5 to 7 years before clinical symptoms appear, which is really, really good.
We found that compared to amyloid negative individuals, amyloid positive individuals demonstrated decreasing MTB scores over time. Amyloid negative individuals tend to improve or show a practice effect over time, whereas amyloid positive individuals do not benefit from this practice effect and decline over time.
All right, think about that. When healthy people take the same test multiple times, they naturally get better by about 10 to 15%. That's basically the practice effect I explained before. But those developing Alzheimer's lose this ability to improve, even in the preclinical stage where they still score normally on single tests. So this smartphone app can detect that loss, giving us early warning years before memory problems become obvious. The app is currently being validated in research settings and should be available for clinical use within 1 to 2 years. Cool. If you're finding this information valuable, please subscribe to this channel. And as an ApoE4 carrier myself, I'm committed to bringing you the latest breakthroughs that can help us take control of our brain health destiny. Hit the notification bell so you don't miss any of our upcoming videos on treatment advances and prevention strategies. Cool. Back to it on a topic that I love, AI. So perhaps the most personalized breakthrough came from Dr. Dawn Shin at Samsung Medical Center in South Korea, basically using artificial intelligence and machine learning on data from 1,700 plus participants. They have created a staging system that predicts individual disease progression, not just whether you'll develop Alzheimer's, but when and how fast.
In phase 1, we aim to identify prognostic risk subgroups within clinical diagnosis. Using modified random survival force, only P-tau217 and age were selected in the final decision tree, while other variables, such as amyloid PET positivity, were not selected.
So this is remarkable. P-tau217 from a blood test proved more predictive than even expensive amyloid PET scan that cost 5 to 7K. This AI system doesn't just categorize you as positive or negative. It creates a personalized risk profile predicting progression to mild, moderate, or severe stage based on your CDR-SB or CDR sum of boxes scores, which is the clinical dementia rating sum of boxes, where 0.5 to 4 is very mild, 4.5 to 9 is mild, and above 9.5 is moderate dementia.
Our prognostic staging captured progression risk beyond cognitive status. Taken together, our findings suggest that biomarker integrated staging could capture more precise and clinically meaningful risk stratification rather than cognitive status alone.
So for us ApoE4 carriers, what does it mean? Well, it means we could know not just our increased risk, but our personal timeline. Crucial information for deciding when to start preventive treatments or join clinical trials. The system can predict progression timeframes within 2 to 3 years windows with approximate 85% accuracy. Next, Dr. Fernando Gonzalez Ortiz from the University of Gothenburg presented groundbreaking work on something called MTBR, which is microtubule binding region of tau. This is a section of the tau protein where it becomes toxic and forms the neurofibrillary tangles that kill the brain cells. Think of MTBR as tau's weapon, and now we can measure it in blood at concentrations as low as 10 picogram per milliliter.
The early repeat 1 segment of the MTBR is enriched in AD pathology. Phosphorylation at serine 262 is an aggregation-relevant epitope, and moreover, phosphorylations at serine 262 and 356 can inform of early-stage tau aggregation.
So they've identified the exact amino acids positions where tau becomes dangerous. It's like finding the trigger mechanism on a weapon. When phosphate groups attach at these specific sites, tau protein clump together, forming toxic aggregates. More importantly, these MTBR markers in blood accurately reflect what's happening in the brain. And it correlates with BRAC staging, which are the 2 6-stage system tracking tau spreads through the brain.
We observe significant increases according to increase in BRAC staging with this novel MTBR1 assay. And then we observe an association between MTBR1 and tau PET SUVR as similar to what has previously been reported.
Here's what matters most for us carriers. These markers predict future decline with a correlation coefficient of 0.74, meaning they can explain about 55% of the variance in cognitive decline.
What we observe is that levels at baseline of MTBR1 were associated with longitudinal cognitive decline in these individuals. In both cases, 262 and MTBR1 associated with longitudinal cognitive decline, but 262 associated also with baseline cognition.
Next, we have Dr. Katie Vandeloo from Canada, who presented findings that every woman carrying ApoE4 needs to hear. Women not only have higher baseline inflammation, but their brains are more vulnerable to its effects, a critical finding given that 2/3 of Alzheimer's patients are women.
Females in red had higher levels of CRP overall compared to males in purple with a Cohen's d effect size of 0.52. At higher levels of inflammation, females in red demonstrated lower gray matter volume in comparison to males in purple.
So CRP for C-reactive protein is a marker of inflammation we can measure with a very simple blood test for about $30 to $50. All the labs. Normal levels are under 3 milligrams per liter, but the research showed that even within the normal range, inflammation literally shrinks women's brain more than men's. So basically, for every 1 milligram per liter increase in CRP, women lose around 2% more gray matter volume than men, along with reduced white matter integrity that is measured by fractional anisotropy and increased free water. Essentially, the brain is swelling from the inflammation.
Sex-moderated relationships between inflammation and brain health outcomes, including gray matter volume, fractional anisotropy, and free water. More specifically, at higher levels of inflammation, females exhibited lower brain health.
So if you're a woman, your inflammation control is extremely critical. The good news is that CRP is so easily measurable at any lab, and inflammation is treatable through so many different things, right? Like in the Mediterranean diet, taking supplements, or any other anti-inflammatory diet can reduce your CRP by 20 to 40%. And then you stack on other interventions. Exercise like aerobic exercise can reduce CRP by 30 to 50%. And then you add on supplements like omega-3s, curcumin, and resveratrol, and then you can really have that under control. So you have really no excuse to have high inflammation. If your CRP is high, please, please, please get it fixed by using all these lifestyle interventions and add on those supplements. It's really a quick win that is no regrets. Next, we have Dr. Xiaqing Jiang from UCSF, who revealed something that affects nearly all of us. Basically, how common health conditions may accelerate Alzheimer's pathology. They basically studied what's called multi-morbidity, having multiple chronic conditions like diabetes, hypertension, heart disease, or obesity from a list of 22 conditions.
Multimorbidity was highly prevalent in the population, with more than 89% of the participants have more than 2 conditions. Higher multimorbidity burden was associated with higher levels of plasma P-tau217, and we also saw a trend towards higher amyloid PET SUVR.
So they found that 89% had multiple conditions, and each additional condition increased Alzheimer's biomarkers by around 15 to 20%. Having 4 more conditions doubled the risk of abnormal biomarkers. But here's the crucial thing: these conditions work through multiple biological pathways simultaneously.
Higher multimorbidity burden was significantly associated with these pathways. Among these pathways, we saw that neurodegeneration explains 74% and AD pathology explains 24% of the association.
So the takeaway here is that managing our overall health is not separate from brain health. It's fundamental to it. For ApoE4 carriers who we are already at such a higher risk, depending on if you are a homozygote or a heterozygote, controlling your blood pressure, keeping it basically under 120/80, controlling your blood sugar to not be pre-diabetic or diabetic, controlling your inflammation, as we discussed before, becomes really critical. Each condition we prevent or control reduces significantly our Alzheimer's risk multiplicatively. And what I like about these, it gives us a lot of hope because we have full agency over that, right? Diabetes, hypertension, all of that is really under the control with lifestyle changes, medication, supplements. So you can really act on it. So that's why I always believe that knowledge is the power. Now that you know about it, these are your 80-20 things that you should do. The most efficient things that you can do to control your Alzheimer's risk is really to get your health, overall health, under control. So Dr. Maria Zambrano Astorga from Mexico presented a breakthrough in comprehensive testing, which is an 11 protein panel called PPAB11. So don't ask me why they chose such an interesting acronym, but that outperforms single biomarkers with areas under the curve, reaching 0.92 to 0.95.
We can see that our protein panel demonstrated a really good diagnosis performance and has comparable or even outperformed the IUC value on another proteomic panels. Something that is outstanding about our protein panel is that it has the best sensitivity across all the cohorts.
So this panel doesn't just detect Alzheimer's with a 95% sensitivity, it reveals which biological processes are affected. These 11 proteins include markers from synaptic damage, like the neurogranin, metabolic dysfunction, like ApoE levels, and that is the ApoE protein levels, and immune activation, like complement proteins. Each protein tells a different part of the story, and together they give you a holistic view.
We found 3 main clusters of our proteins that are associated with signaling and neurodevelopment, with metabolism, and with synapse. Our proteins are involved mainly in immune activity and also in angiogenesis.
So the whole goal of this comprehensive view is to give and guide your personalized treatment. If your panel shows mainly metabolic issues like elevated insulin or degrading enzyme, altered glucose transporters, etc., you'd focus on metabolic interventions like, let's say, taking metformin or even doing intermittent fasting. If, on the contrary, it shows immune activation, so let's say elevated complement C3 or interleukins, then you target inflammation with specific anti-inflammatory protocols. This panel approach is expected to be commercially available within 2 to 3 years. So since we're filming that in 2025, let's say 2027, at an estimated cost of $500 to $800. And when you think about the life cost of developing Alzheimer's and losing your independence and getting unhealthy, I believe all these tests are really, really worth the price. Cool. Now let's summarize. The biomarker revolution that the researchers presented at the AAIC in July is not coming in a very far future, right? It's almost there or already there. We now have FDA-approved blood tests that are up to 97% accurate. We have smartphone apps that detect cognitive changes years early, and we have imaging that see neurodegeneration before brain shrinkage happen. For us ApoE4 carriers, this means we can track our brain health regularly, affordably, and accurately. And remember what we say in all the fields: what can be tracked can be improved. You really want to have a baseline and to be able to measure whatever you are doing compared to that baseline, because otherwise you are doing a lot of interventions blindly. This is one of the key parts of the Phoenix community, to be able to guide you in building those experiments in step by step and telling you what to test, when to test, and what to do. If you're ready to take action, join us in the Phoenix community, where we help ApoE4 carriers like you beat the odds and outsmart Alzheimer's. And this goes through navigating all these new testing options and then creating personalized prevention plans. And remember, early detection is not about creating stress and fear. It's about the power of knowledge, the power to intervene while we can still make a difference. You've seen through so many different videos in this YouTube channel that the earlier you act on it, the better. And if by testing, it gives you the additional boost and the additional motivation to go run, to go eat healthy, and so on, I believe that's a huge win overall, not only for your brain health, but for your everyday energy and for your overall longevity. So stay informed, stay proactive, never stop fighting. This is Kevin, and I'll see you in the next video.